Well, it's no secret that every one of my members thinks that Obamacare was a huge legislative mistake. It has fouled up the health insurance market, put states in a deep hole in terms of the Medicaid expansion and their own ability to finance it a few years from now. If I had the ability, Carl, obviously I'd get rid of it.
In the new political era, the midterm elections have thrust America into one thing that at the core of the changing of leadership was, without question, the Affordable Health Care Act. But now comes the real work. Plenty of Republicans want Obamacare completely scrapped. Others note that's simply impossible. The more efficient and smarter way to go would be to rip into the law, fix what's wrong, then snap back to what it is, and you just can't do it. They say you got to start from scratch. So let's get some reality or decide what is the best and most effective path. That's why we welcome back to MidPoint Newsmax Deputy Health Editor and author of the Obamacare Survival Guide. Nick Tate joins us in the studio today. All right, Nick, now we get to make some sense of it. Let's see, we've only got about 4 minutes here, but it'll take about 4 days. What's, in many ways, in the expert's opinion, what's the best thing to do? Completely gut it or work from inside?
Well, that's the debate, is whether you summarily execute this thing or you kill it death by 1,000 paper cuts. Seems to me the likelihood is what we're going to see is we are going to continue to see votes for wholesale repeal, but the expectation is the president is going to veto those. As long as he's in the White House, he's not going to sign a law that gets rid of his signature legislative achievement. You can bet on that. So what is also likely to happen is House members and Senate members, Republicans and Democrats, could move forward today with a handful of steps that would basically gut some of the more onerous components of the Obamacare plan. For instance, immediately get rid of the medical device tax. There are other taxes that could be trimmed out. Number one. Number two, delay or modify the employer mandate that requires employers and businesses to provide health benefits to their employees. That's supposed to kick in January 1. With a stroke of a pen and with legislation that could be passed today, they could postpone it, they could delay it, they could defund it. Medicaid reform allows states to move toward a more HMO model. Some states are actually trying to do that. Illinois is one of them. Florida, they're looking at HMO models to replace the Medicaid system so that people either have to pay a copay or premiums or they privatize it. Arkansas is another example. So those are three right away that Congress could do with bipartisan support. Democrats are on board with some of these plans. The president said he's open to some of those changes. So as we heard Boehner say, yes, we'd like to rip this thing out root and branch, but if we can't get wholesale repeal, we'll get what we can. Take these first steps, and then maybe next year, maybe in 2017, you can repeal the whole thing.
The big question I've always had, and many people do, is if you take the entire Affordable Health Care Act and you scrap it, you cut it completely, what then happens? Look, nature abhors a vacuum. All of a sudden, you have all of these things that are sitting there. That seems to me that that would be the stupidest thing to do because you would leave so many things dangling.
Well, there's also a political minefield here for Republicans. There's about 10, 11 million Americans that now have benefits. They bought their health insurance through Obamacare exchanges with a federal subsidy at a discount. Parents who have their kids on their health insurance up to the age 26. Seniors on Medicare who got a bunch of front-loaded sweeteners, declines in health care costs, free cancer screenings. Are Republicans really in a position to go back to those folks and say, we're going to take these benefits away from you? And what kind of a backlash might that create heading into the presidential election in 2016? So it would create a vacuum, but it would also create some political liabilities, it seems to me, to the conservatives on the right. So it seems to me that right now there are some things that a lot of people agree on, health experts as well as political leaders in both branches on both sides of the aisle could move forward with, and I don't know why they wouldn't.
Is it not fair to say, though, because we now have we're already in the run-up to 2016.
Yes, we are.
That it is very unlikely that anything will happen of a substantive change between now and the election. Would you think that possible?
I like to be optimistic.
I'm
the
pessimist in the group.
Fair enough. There have been lots of changes that have already been made piecemeal. In fact, little-known changes to the employer mandate were made earlier this year that both House and Senate Republicans and Democrats agreed to that relaxed some of the laws, and the president signed it. So there have been some modifications. There's been about 40 aspects of the plan that were supposed to take effect that have either been delayed, jettisoned, shelved, or are behind schedule. So there's some history here to show that you can make changes that are substantive and they are not entirely, window dressing.
Stick around. You're going to be talking about this for a long time. And so will we be talking about it for a long time. MidPoint will continue.